In this video, you'll learn how to safely manage and clean up hazardous and cytotoxic spills. Upon discovering a spill, immediately assess the extent and type of the spill. Determine whether the spill is wet or dry, or if anyone has been directly exposed to the drug. Caution patient and bystander about the spill and limit traffic to the area. In order to protect patients and other staff, open your spill kit and post the included warning sign to discourage anyone from entering the spill area. Open and set up one of the waste bags included in your kit and set aside for later use. Make sure to roll the seam outward to reduce contamination. Inside the spill kit, you will find fluid repellent lint-free gown, 2 pairs of gloves, large and extra large, safety glasses, a respirator mask, a pair of shoe covers, 3 absorbent towels, Chemo Care Plus, 3 Chemosorb pads, a scooper and scraper, and 2 yellow hazardous waste bags. For your protection, put on the personal protective equipment included in the kit. First, put on the disposable fluid repellent gown, tying it behind your neck and waist. Next, put on the respirator mask to protect from inhalation of vapors. Make sure it is fitted securely to the bridge of your nose and covers under the chin. Whenever possible, use the respirator mask for which you have been tested. Put on the safety glasses. Put on the smaller size chemo-approved gloves, tucking them inside the cuffs of your gown. Followed by the pair of larger size gloves, extending them over the cuffs of the gown. Finally, put the shoe covers on over your footwear. Keep in mind, anyone who assists in the cleanup must also wear complete personal protective equipment and don it in the same way. In addition, you will also need detergent or Hazardous solution, towels, a cytotoxic waste sticker, 1 red cytotoxic waste bag, or red hard container if available, a bucket, and water. For liquid-based spill management, soak up the medication using the Chemo Care Plus absorbent pads provided in your kit. If applicable, clamp the IV tubing. Remove and discard both the IV tubing and bag into the hazardous waste bag. Use the scoop and scraper to lift the used pads. When managing a spill with broken sharps, use the scoop and scraper to gather any broken sharps and discard in hard sharps container. Do not place sharps in a plastic bag. For dry spill management, if the spill is a powder, wet one of the towels and gently place it on top of the spill to contain it. Clean the area with detergent diluted in water. If using Hazardous, apply the Hazardous solution directly onto a towel. Clean the surface from the least to most contaminated area. Rinse twice with clean water. Discard towel immediately after each use. Do not put any used towels back into the water. Follow the same cleaning procedure for non-disposable contaminated equipment, such as a chair, table, and IV pole. To remove protective equipment, start by removing a first pair of gloves inside out, placing them all in the waste bag. Remove gown from inside out to reduce contamination. Discard all materials used to clean the spill in the waste bag provided, being careful not to contaminate the outside of the bag. Then remove the goggles and the respirator. Remove the shoe covers. Use one of the tie wraps to secure the yellow waste bag. Place the yellow waste bag in a red waste bag or hard container. These are not included in the spill kit. Seal the second waste bag and place a Cytotoxic sticker on the outside of the red bag. Place the bag container into a dirty utility room. Once everything has been cleaned and disposed of, make sure to wash your hands thoroughly with soap and water.